How does walking help your back? All right, in this segment, we're going to be talking about, is walking good for low back pain? I'm Dr. Paul Lieber from Regenexx Pittsburgh. Is walking good for your lower back? Walking really is a great exercise for low back pain. It's the cornerstone of most rehabilitation for low back pain. The only exception to the rule is if you have what's called spinal stenosis with neurogenic claudication. That is a condition where your spinal canal is so narrowed from degenerative changes that the nerve signals and impulses are not getting through to your legs, and your legs become progressively weak and painful with walking. And for those folks, walking to tolerance is a good thing to do, but often the tolerance for walking is very limited because the nerves in the spinal canal are being pinched when you're standing upright. For all other spinal conditions in the lumbar spine, walking is a great exercise. First, it strengthens both the muscles in the back and the muscles up front, along with strengthening the legs while you're walking. It helps with coordination, which is important. It helps with balance, and it helps with lumbar stabilization. So it is a way in which you can increase your function and mobility, increase your strength, increase your conditioning just with simple activity. Typically, you need to start at whatever you find your baseline is, whether that be walking a block, walking a mile, and working your way up to perhaps several miles of walking at least once a day. There are now devices that people have that they wear on their wrist where they're counting their steps throughout the day, and that can be a way to keep track of walking distance so that you can progressively increase your walking. And just like exercise, I'll tell people to increase your walking or your exercises about 10% per week, should you be able to tolerate it. So walking does help the spine, the muscles in the back, the muscles up front in your belly, stabilize the spine. So it's really all good. You're strengthening and conditioning simultaneously. So if you're measuring your steps with a Fitbit or some other type of apparatus that you're wearing on your wrist or on your belt or something like that, a good starting place would be 500 to 1,000 steps a day. I think that working up to 5,000 or more steps a day is ideal in terms of conditioning and strengthening for helping your low back. You've tried stretching, you've tried strengthening, you've tried walking, but you're still having low back pain. In the next video, I'm going to talk about some additional options for you.